Hi, my name is Dr. Matt Winter and I am a urological surgeon. I am pleased to welcome you to this video discussing robotic radical prostatectomy. A radical prostatectomy is the removal of the entire prostate gland, seminal vesicles, part of the vas deferens via keyhole incisions with the assistance of a robot operated by myself. The draining lymph nodes within the pelvis are also removed to ensure the cancer has not spread. I will perform the operation in a nerve-sparing way, providing the cancer has not spread outside the prostate. The operation will be performed under general anaesthesia and generally takes 2 to 3 hours to complete. Keyhole incisions will be made and working ports will be placed in the skin and the robot will be docked in the appropriate position. As the surgeon, I will be sitting down on the console to operate the robot. The robot has 4 robotic arms, 3 for instruments and 1 for a high-definition 3D camera. The instruments are attached to the robotic arms and introduced into the abdomen via the working ports. 1 to 2 other ports will be placed so the assistant can assist with the operation. We are able to carry out controlled and precise movements using robotic assistance. The robot cannot perform any independent movements and the instruments of the robot are solely reliant on our movements. The instruments are small, approximately 7mm wide, and due to their small size, they have a greater range of motion than the human hand and will allow me to carry out the operation in 3 dimensions within the small space in the body. Once the prostate gland is removed, the seminal vesicles and part of the vas also removed, they'll be sent for pathological testing. The lymph nodes on both sides of the pelvis may also be removed and will also be sent to the lab for examination. The bladder will then be rejoined to the urethra and a catheter will be placed through the penis into the bladder to drain urine and protect the joint. A drain tube may be placed into the pelvis to remove any excess fluid. This will be blood or lymphatic fluid. It's also there to test for any urine to ensure that there's no leak. The benefits are it may cure your cancer or slow the growth of the cancer. Radiation and/or hormonal treatment can still be used as an adjuvant treatment in the future if later needed. What are the risks? As with any surgical procedure, there are risks of unsuccessful results, complication, and injury or even death from known or unforeseen causes. There is no warranty or guarantee that can be made as to the result or the cure of the cancer. The general risks of surgery include anesthesia-related issues, your anaesthetist will discuss in greater detail, bleeding during the operation, which may require a blood transfusion, blood clots in the legs, deep vein thromboses, lungs, pulmonary emboli, or brain, stroke. Heart or lung problems, for example, abnormal heart rate or rhythm, chest infection, collapsed lung may occur. Adverse or allergic reactions to medications can occur. Damage to nearby structures such as the bowel, the rectum, liver, spleen, ureter, blood vessel, or nerves. Pain, scarring, rupture or hernia of the wound closure. Infection, blood, urine, or wound can also occur. The specific risks of a robotic radical prostatectomy include the urinary side effects. Urinary incontinence. You will require the use of a continence pad after the catheter is removed. Urinary control will generally improve with time and pelvic floor exercises, such as Kegel exercises. I expect 80% of patients to be dry at 3 months. A urinary leak may occur at the join between the bladder and the urethra. This will generally require the catheter to remain in for another week or 2. Most of these leaks will heal completely by themselves. Bladder muscle weakness, causing inability to pass urine when the catheter is removed. This may occur and you may need a catheter to be inserted again to allow time for the bladder muscle to recover. Scarring at the anastomosis, called a bladder neck contracture, can occur. This will present as a weakening of the urinary stream. This may require a cystoscopy and endoscopic opening of the scar in the future. Sexual side effects. Erectile dysfunction. This may or may not recover depending on your pre-existing erections and the extent of cancer, which will determine if a nerve-sparing operation can be safely performed. The erectile dysfunction can usually be treated with oral medications such as Viagra and injections into the penis. If the problem persists, a penile prosthesis may then be an option. Sexual intercourse may feel different after the operation. You will have no ejaculation, hence you will be infertile. Your orgasms will still be maintained. Penile shortening can occur after the operation as we pull the urethra back to join with the bladder. This will improve over time with penile stretching exercises. Other side effects include a lymphatic fluid collection, such as a lymphocele in the pelvis or ascites, which is fluid in the abdomen. Your head is down during the operation, and this may cause some increased pressure in the chest cavity or in the eye. This may present in difficulty breathing or visual side effects, which are generally temporary. The other side effect of radical prostatectomy is that the cancer may not be cured, or discovery that the cancer cells have already spread outside the prostate into the lymph nodes. This will require additional treatments such as radiotherapy or hormonal therapy. Injury to the rectum or ureters requiring additional surgery or repair to the injury may occur. This is a very unusual event and occurs in less than 1% of cases. An abnormal connection between channels in your body, a fistula, may occur. Again, this is between the rectum and the bladder, or the urethra, ureter, or where the prostate was. This occurs in less than 1% of cases and is extremely uncommon. Testicular swelling and pain is not uncommon. Rest and supportive underwear will generally resolve the problem. Gas from the operation can be trapped in the abdomen or under the skin. This can cause mild abdominal discomfort, shoulder tip pain, and reduced bowel function. In extreme cases, the gas can form an embolus, which is absorbed into the vessels during the operation. This can affect blood flow and heart function. If you are undergoing a salvage radical prostatectomy, which is a radical prostatectomy performed after radiation or any other focal treatment to the prostate, all of these risks that have been discussed in this video are more likely to occur, especially rectal injury, anastomotic leak, incontinence, and impotence. You will be pre-assessed on your general fitness, and baseline investigations will be performed to ensure you can proceed to the operation safely. You should not eat or drink within 6 hours prior to surgery, and you will usually be admitted in the hospital on the same day as the operation. If you are on aspirin, please stop that 1 week prior to the surgery. All other blood thinners will need to be stopped before the operation. Please inform me if any blood thinners you are taking so I can advise you when to stop them. To be in the best possible condition before surgery, I recommend that you exercise, eat a healthy diet, lose weight if you need, stop smoking, practice your pelvic floor exercises. I will arrange a physiotherapy consult prior to help you know what to do with these Kegel exercises, and also help your continence return after the surgery once the catheter is out. Once your surgery is complete, you'll be taken to the recovery area. Although you have had minimally invasive surgery, you still may experience some mild discomfort. It is important to let the staff know in the recovery area if you feel any pain or nausea so that we can treat you appropriately. You will have 5 to 6 small incisions where the port sites were closed, and dissolvable sutures will be used. We may also place some skin glue over the area, which will dissolve in time. You may have a small soft rubber drain next to the incision in the lower abdomen. The drain will typically be removed before you go home. You will have a catheter going from the penis into the bladder to drain the urine out and protect the joint. You will go home with this catheter. Once your condition is stable, you'll be transferred to the ward where you will stay overnight. You'll be given clear fluids to drink and progress to a regular diet as you tolerate. You'll be strongly encouraged to sit out of bed in a chair and then walk around the ward as soon as possible. Early walking after surgery is a critical aspect of your recovery and will help you return to normal bowel function, eliminate the gas that has been insufflated into your abdomen during the surgery, and prevent any blood clots in the legs. Breathing exercise with a spirometry machine will also be encouraged. We would advocate you do this as much as possible. This will prevent any complications such as pneumonia or minor lung collapses at the bases, and help with your recovery from the general anesthesia. Most patients are discharged the following day after their procedure. The catheter will remain in for around 7 to 10 days. You'll be ready to discharge when you're walking around, tolerating or have minimal to no pain. You can manage your catheter, you've got no significant nausea or vomiting, and you have got supports in place. We advise a close friend or family member to be with you for the first couple of days until you're managing well. I will arrange any prescriptions for home, which will include pain relief and/or injections to stop blood clots. Please avoid any heavy lifting, nothing greater than 10 kilograms, or any straining for the first 4 to 6 weeks. You can start to exercise and lift weights after this time. Small amounts of urine may leak around the catheter. This is normal, providing the majority of the urine is draining inside the catheter. Please place a pad around the catheter and penis to soak up any leakage. You may have to perform self-injections of a blood thinning medication to help prevent blood clots. I will advise you on this. All of your stitches are absorbable and will generally dissolve in 2 to 4 weeks. You can have a shower, but please do not bath or lay in the pool before complete wound healing, which is roughly 4 weeks. Drink plenty of fluids to keep your urine clear. Avoid any heavy meals and understand it may take a few days for your bowels to get back to normal. You can return to work when you feel up to it. Some patients choose to work with their catheter in. You'll need to make a follow-up appointment with me in 7 to 10 days after the procedure to remove your catheter and review the pathology. Please bring some pads with you the day the catheter is removed just to absorb any leakage. Do not try and remove the catheter yourself. You will begin pelvic floor exercises as soon as the catheter is out and will begin penile rehabilitation at that same time. I will monitor your PSA closely after the operation. The goal is to ensure your PSA is undetectable at approximately 2 months following the operation. If your PSA fails to become undetectable or rises in the coming months to years, or you have extensive cancer and pathology, I may recommend radiation or hormonal treatment. Please inform me if you have any bleeding that is getting heavier, not lighter, you develop a fever, or you have any problems passing urine or worsening pain. Please do not hesitate to contact the office if you have any concern that is not addressed in this video. I hope you found this video informative, and I trust it has better equipped you and your family to prepare for your upcoming operation. I am available to answer any questions you may have, or you can contact my office if you have any concerns. I look forward to helping you resolve your urological problems, performing the operation, and caring for you during the recovery.